Very well. Once again, a very good afternoon to a wonderful team. I'm very glad that you all are here for understanding We Innovate Biosolutions. So, to begin with, moment you take the name of the company We Innovate Biosolutions, you automatically become a part of the journey of innovation that the company is doing because the name itself says We Innovate Biosolutions. So, welcome to our company. Before we understand more about the product, let us understand the problem that the company or the technology is addressing. We are addressing the grave problem of CAUTI. It is catheter associated urinary tract infections. As I'm sure you all must be knowing that CAUTI is one of the leading causes of healthcare associated bacteremia. Almost 70 to 80% of UTIs that happens in a hospital is because of a catheter associated UTI. And it is the most common type of hospital acquired infections as per worldwide statistics. Now, what happens in CAUTI is mostly 40% of the hospital acquired infections, which happens when a patient is hospitalized when the patient is hospitalized, it originates in the urinary tract. Once a patient is catheterized with a catheter, every day the risk of getting infected from that catheter increases by 3 to 7%. And this ultimately results in more and more number of days of hospitalization, especially in ICU. Around 10 days of hospitalization happens when you are catheterized and if you get an infection. Moreover, CAUTI is causing a lot of morbidity as well as mortality. Up to 7% mortality has been reported in ICU alone because of CAUTI. So in a nutshell, I hope you can see the pointer here. In a nutshell of all the infections that happens, 40% of the infections in the hospitals are nothing but catheter associated UTI. And out of these catheter associated UTI, 80% are what is caused by catheters. Catheters are something, as we all know, it's a tube which goes inside the bladder and it assists the urination of the sample. It basically assists the urination. Now, when a catheter-associated UTI happens, it is basically because of bacteria which are prevailing on the medical devices. Now, this CAUTI causes a lot of reputational loss. It causes economical burden, and more importantly and silently, it is resulting in an antimicrobial threat. What does the case definition or how does ICMR define the cases of CAUTI? Now, as per ICMR, two important factors are needed to ascertain the presence of CAUTI. One, the patient should have some or the other kind of symptomatic signs, which includes fever or suprapubic tenderness. And secondly, any patient who has a urine culture of around 1000 per ml with either single or more type of bacterial species are supposed to be having a case of CAUTI. Now, as per the reports, CAUTI is predominantly caused by gram-negative bacteria, and it is dominated by Escherichia coli and Klebsiella to be the most common CAUTI-causing organisms. However, CAUTI is also caused by gram-positive bacteria and in some cases by fungi also. What happens when bacteria actually enters the catheter or causes CAUTI? So one of the major problem that happens because of catheter-associated UTI is biofilm formation and encrustation. Now, if you can see this picture clearly, what happens, there are certain bacteria like Proteus mirabilis is a common bacteria which causes CAUTI. Now, this Proteus mirabilis has a very swarming kind of a growth pattern. It literally grows like a wave. Moment it gets an attachment on the catheter surface, it starts spreading itself on the catheter surface and forms a biofilm. There's a lot of extracellular material, a lot of EPS which gets accumulated while the bacteria is growing on the surface of the catheter. Now, this can be on the top surface of the catheter or it can be in the inner lumen of the catheter. Now, when the bacteria is growing on the catheter, it is metabolizing and it is utilizing different nutrients which are present in situ. One of the nutrients which the bacteria metabolizes is urea. Now, while the bacteria utilizes urea, it releases ammonia. And as we all know, moment ammonia is released, it increases the pH. It makes the pH alkaline of the environment. And this alkaline pH ultimately results in the formation of crystals of different salts which are present in the material inside. Now, moment these crystals are formed, it basically blocks the catheter. Now, when a catheter gets blocked because of such an action, the patient cannot pass the urine out of the bladder, and there is retention of urine in the bladder, and it causes a very bad stomachache to the patients. Now, this biofilm formation and encrustation is a very common problem which is seen in patients which are catheterized with any catheter. Normally, what is the course of action that happens when a patient is either catheterized or when the patient is either diagnosed with a COUT? Normally, there is no antibiotic given directly. However, if the symptoms arises for COUT, the patients are prescribed with antibiotics like nitrofurantoin, levofloxacin, amikacin, or in some cases, higher generation antibiotics like meropenem family. In case when the COUT is caused by a fungal infection, there are specific antifungal agents which are given to take care or to control the COUT. Now, if you see the list of antibiotics or antifungal agents which are listed over here, they're all high generation antibacterial agents and antifungal agents, and also they are very expensive. While we are pumping antibiotics into the patient's body to control the COUT, there is a risk associated with this antibiotic therapy. That risk is called as the antimicrobial resistance. The bacteria are gaining resistance because of a lot of genes that they harbor. So the bacteria are very smart, and because of some horizontal gene transfers, because of some gene exchanges, they keep acquiring genes which are going to give them resistance towards these commonly used antibiotics. That means if you get an infection by a bacteria which has caused resistance to these antibiotics, none of these antibiotics will work on the bacteria, and hence the bacteria can be labeled as a multi-drug resistant bacteria, and this can result in the death of the patient. So this is a major problem which happens with antibiotic treatment. So in a nutshell, when a catheter-associated UTI happens, there are implications on the patients as well as on the hospital. To begin with, moment a patient gets a UTI in the hospital, his or her stay in the hospital increases by many folds. As per literature, it is almost 15 days of extra hospitalization if you get a UTI in the hospital. Now, moment you get a UTI, you are overburdened with a lot of antibiotics which is given to you, a lot of antibiotic testing which is done on you. Then you have diagnostic tests which is done to understand which pathogen is causing the UTI. So these diagnostic tests as well as the antibiotic course which is given to control the UTI causes a huge economic burden on the patient. And lastly, because of the increased stay in the hospital as well as the antibiotics which is going inside the patient's body, there's a lot of fatigue, both mentally as well as physically to a patient. This is in case of the patients, but even the hospital is at risk if the patient which are there in the hospital causes UTI. First and foremost, majority of the revenue that a hospital makes is during the first few days of hospitalization. So if the hospital is keeping one patient for a very long duration in its bed, basically it is occupying the bed for a very long time for a single patient, there is a clear-cut revenue loss for the hospitals. And of course, if the word of mouth spreads that in this hospital there is an infection case which has happened, then people normally dread to go that hospital. So basically, there is a loss of reputation. And lastly, the hospital also end up using a lot of antibiotics, which are ultimately adding to the burden of antimicrobial resistance. So in all, catheter-associated UTI is a very pressing problem, which is having detrimental effects both on the patients as well as on the hospitals. So what should be done to address this problem? Now, as you must be going in the hospitals, you all know that there is something called as COUT bundle. So there is a protocol which is there to take care of the patients if the patient is catheterized. This is of course there, but in spite of this being there, there are cases of COUT. That means there is a need for an intervention. There is a need for an improvement. And hence there is a need for preventive strategies like antimicrobial catheters. So here is where We Innovate Biosolution comes into the picture with its product called as SilvoGuard Antimicrobial Foley Catheter. Now, SilvoGuard Antimicrobial Foley Catheter is basically a catheter which is going to prevent infections. And moment it prevents infections, it is going to enrich the lives of the patients who are catheterized. Now, this SilvoGuard catheter which is there, it is made antimicrobial with the help of active silver nanoparticles. So it is the silver nanoparticles inside the catheter which makes the SilvoGuard catheter antimicrobial. It is not any kind of antibiotic or any other chemical or any other drug which is used to make the catheters antimicrobial. It is only and only because of the active silver nanoparticles that SilvoGuard catheters are antimicrobial. Most importantly, this SilvoGuard antimicrobial catheter will remain like so throughout its shelf life, preventing UTI till it is in use inside a patient's body. So let's understand more about the product now. We know the problem. Let's understand more about the product. So SilvoGuard antimicrobial Foley catheter, as I said, it is an antimicrobial catheter and it is impregnated with nano-agicide. I would like to focus over here the word impregnated. Impregnation means it is going to be within the catheter material itself. It is not a coating technology. It is a technology in which the active ingredient, which is silver nanoparticle, is actually mixed in the raw material of the catheter itself, and hence the catheter is impregnated with silver and is antimicrobial. Now, this results in two things. One is the entire product from end to end becomes broad spectrum antimicrobial in itself. And secondly, it causes sustained and slow release of silver ions. So because of these actions, the SilvoGuard antimicrobial catheter will always kill any kind of bacteria which comes even in close vicinity of the bacteria of the catheter. And because of this killing action of bacteria, it will prevent biofilm formation or encrustation that will happen, ultimately causing the prevention of COWT. So I'm taking a slide over here to explain the terminology of impregnation. So moment we say impregnation, as I explained again, that it is the catheter material in which the silver nanoparticles are mixed, and hence it is impregnated. Because of this action of making the catheters, the antimicrobial activity is a long-term activity. So it is not a coating thing which will come and go. It will always stay there till the catheter is there. Second, there is absolutely no chance of loss of the activity. Sometimes there are a lot of antimicrobial catheters in the market which are coated. In that case, what happens is because of physical wear and tear, if say somewhere the coating goes off, that antimicrobial activity of that portion is lost. And a naive portion is exposed to the bacteria, and there the bacteria can colonize and cause the infection. But in this case, even if because of physical wear and tear is there is a loss of the top layer of the catheter, the inner layer which gets now newly exposed is again having the silver nanoparticles, and is hence it is again going to be antimicrobial in nature. This silver is mixed very cleverly during the entire manufacturing process so that it is evenly distributed in the catheter. Now, because the silver is present throughout the catheter material, the bacteria cannot sit on the top surface, it cannot sit inside the inner lumen. There is no chance of any encrustation or any kind of bacterial adherence to happen, and hence there is no biofilm formation and no encrustation. Now, many of the catheters, they require some kind of a pre-activation step. Many of the antimicrobial catheters that comes in the market, they require, before the insertion into the patient's body, there are few steps which are required to make their coating effective by some activity steps, by carrying out some activity steps. But in this case, there is absolutely no additional required. You just have to remove the catheter from the pouch and you have to insert it into the patient's body. So, presenting you all with the SilvoGuard antimicrobial Foley balloon catheter. I hope the product is visible. So this is actually how the product looks like. I'm sure you must have seen the product by now. So there are few USPs, there are few unique selling points of the catheter apart from it being antimicrobial. Like the product is antimicrobial, that's the main important thing. But even beyond this, there are certain attributes of SilvoGuard Foley catheter which makes it even better than the other conventional antimicrobial catheters. Like if you see the packing of the catheter, this packing material, if you see, It's a very special Tyvek paper. It is a non-wettable, high-quality paper. It is not just any medical grade paper in which the other catheters are packed, but this is a very special kind of a packaging material which is not used by any other catheter manufacturers across the globe, I would say. So because it is non-wettable, the product remains good and the product remains intact till its shelf life. If by mistake I'm keeping it on my table and the saline drops on it or the water drops on it, it's okay, just wipe it off and it's still going to be sterile. Second and very important feature that we have kept in mind while designing this catheter is there are physical modifications that we have done in the catheter. One of the very important physical modifications that we have done is we have narrowed down or we have decreased the space between the balloon and the eye. So what happens is you see the tip. So there is an eye at the tip of the catheter and then there is a balloon which blows over here. So when the distance is minimized between the eye and the balloon of the catheter, there is minimal chance of urine retention to happen. Mostly one of the predominant reasons for COWT to happen is that the urine retention is there, and urine being a rich media, it gives an opportunity to the residing bacteria to grow and make and create an infection there. But in this case, because the urine retention is not there, again, that medium for the bacteria to propagate and multiply is missing, and hence the UTI doesn't happen. The chances lowers down. Then another thing that we have done is the urine bag port is going to be quite separate or quite distant from the actual the fixed valve, which increases or rather which decreases the chances of cross contamination or infection to happen. Apart from being non-wettable, it is non-tearable also. Like here you can see I'm actually applying force and I'm trying to tear it, but I cannot tear it. But if you see any other pouch, you will be able to, with slight force, you will be able to, give it away. Like I have a pouch over here. If you see this, I can tear it, see? And if you see the SilvoGuard, I'm applying the same pressure, but I cannot tear it. So this is again a differentiating factor of SilvoGuard catheters from the other available catheters in the market. The USP being antimicrobial, there are physical modifications that have happened in the catheter to improvise its functioning, and there are extra care taken in its packaging, which maintains its sterility for the better use into the patients. Now, before going into the regulatory things and the clinical trials and other studies, the SilvoGuard catheters were checked thoroughly by doing some very sensitive in vitro tests by third-party laboratories across India. Some of the tests which explains the activity of SilvoGuard. Like here, if you see the plate, there are 3 plates over here. So in the 3 plates, there are 3 different types of bacteria which are most commonly causing UTI. You can see Escherichia coli, you can see Proteus mirabilis, and you can see Staphylococcus aureus. The CNT means control. Control catheters are the one which are the regularly available catheters in the market, and test catheter is the one which is nothing but SilvoGuard. If you see over here, the entire plate is whitish or creamish in color, except for area near the catheter or near the SilvoGuard catheter. This is called as the zone of inhibition test. Zone of inhibition means once you put the bacteria all across the plate, and then you place the catheter samples on the plate. You incubate the plates. If you see a zone of inhibition, it indicates that the catheter is releasing an antimicrobial agent, in our case silver ions, and is killing the bacteria in its close vicinity, which doesn't happen in case of control. This kind of data we could see for most of the pathogens, for all the pathogens that we tested, including some of the multi-drug resistant pathogens that we tested causing UTI. Another evidence that it is killing the bacteria and not just pushing the bacteria away. We wanted to find out whether it is killing the bacteria or whether it is just repelling the bacteria away. We did a test in which it was a very sensitive test in which a dye is involved. So you see over here, the E. coli and S. aureus were taken. So in case of control, wherein the catheters were not immersed into the sample, the bacteria are still able to they're still able to reduce the dye and convert it to purple color. Whereas in case of control, the bacteria were dead and hence they were not able to metabolize the dye, and the dye remained in its original yellow color, which was there. We then found out whether, okay, it is killing the bacteria, but can it also inhibit the biofilm formation? So one of the best ways to study was to do a scanning electron micrograph of the SilvoGuard catheters, which was dipped inside the bacteria. So we took two catheters, SilvoGuard catheter and a control catheter. Both the catheters were dipped into, UTI causing bacteria. And after X number of days, like in this case, 48 hours or 192 hours, in fact, what we did was we did the scanning electron microscopy of both the pieces. You see, interestingly, in 192-hour case, in case of both also, in case of control, you will see a nice mucoidal smooth surface. That is nothing but an indication of a biofilm formation, because when a biofilm is formed, you will see a lot of EPS, which is there, extra polymeric substances. And this EPS looks like a very smooth surface in SEM. In case of SilvoGuard catheter, you can see a very rough, patchy surface. This is nothing but the dead bodies of the microorganisms, I would say, or an indication that no biofilm was formed. So these in vitro experiments thoroughly established the fact that SilvoGuard catheters are antimicrobial in nature, wherein they kill the bacteria that comes in close vicinity of it. Now, once that antibacterial activity was established, we wanted to find out, okay, it's time to go and do some regulatory studies to find out whether it is biocompatible, whether it is toxic or no. So there are international ISO 10993 guidelines, which are used across the globe for any kind of medical devices to find out their biocompatibility and toxicity. So we did a battery of all the biocompatibility tests. In fact, we were supposed to do 4 or 5 tests only, but we went ahead and we did all the 8 tests which were available in the kitty, which indicates whether the product is biocompatible and no. So all the results suggested that SilvoGuard catheters are perfectly biocompatible in nature. We also carried out certain cytotoxicity tests, certain mutation tests, and we found out these catheters were absolutely non-toxic and they did not have any kind of mutagenic effect on the bacteria or so. So this indicated the biocompatibility and the non-toxicity of the SilvoGuard catheters. Moving ahead, whether this product is or whether this catheter is functioning the way it is supposed to function, like there are Foley balloon catheter performance tests which are available, and for any Foley balloon catheter, it has to perform these tests, only then it complies to be a good catheter. So we did all the 6 tests which are necessary for the performance of any Foley balloon catheter, and in all the 6 tests we found that SilvoGuard catheter complied to all the performance parameters for a Foley balloon catheter. We also found out whether these catheters are stable. So there, as I said, there are different 4 typical stability tests which was done. The seal, which is done in the continuity of seals, peeling test and sterility test, all the tests were passed by SilvoGuard Foley catheter. So this is an in vitro, or this is an ex vivo catheterization study. What we did over here is for your understanding, what we did over here was, just excuse me for a minute. So what we did over here was we tried to simulate a bladder in the lab, and we saw what happens when a SilvoGuard catheter is inserted for X number of days. Now this is a normal catheter and this is a SilvoGuard catheter. So if you see over here, the eye, in case of SilvoGuard catheter, the eye looks absolutely clean. There is no debris seen in the eye. Whereas in case of the normal catheter, the eye was already blocked. This is an indication of bacterial growth and biofilm formation. In fact, then you can see the biofilm formation over here, outside surface, some discoloration you can see. In case of SilvoGuard catheters, it was absolutely clean. In case of the control catheters, you can see that there was a lot of debris when you open or when you cut open the catheter, which indicates encrustation, which was absent in case of SilvoGuard catheters. So this proved that the SilvoGuard catheters are going to do its job when it is inserted into a patient's body. Now, this is for our understanding when we go and speak to a lot of doctors, when we speak to a lot of clients, as to when they ask us, what is the difference between SilvoGuard catheter and other antimicrobial catheters, or SilvoGuard and latex catheters. So what we have done is we have made a very exhaustive chart in which we have compared the SilvoGuard catheters with the regular latex catheters, with the infection prevention catheters, and with silicone catheters. So if you see over here, the main difference lies in the technology. Here, in this antimicrobial technology, for in case of infection prevention catheters, it is not an antimicrobial technology because it doesn't kill the bacteria. It only repels, pushes the bacteria away from the surface. So in our case, it is an antimicrobial catheter. So even if the bacteria sits on the catheter, it is going to be killed. So this is the biggest USP of the SilvoGuard catheters. We are using silver as the active ingredient which is doing this job. Okay, and we are using an impregnation technology which I have explained you. In the other catheters which is there in the market, they are a coating technology, and mostly they are some kind of an alloy, or even sometimes antibiotics are used to coat. So there is no biofilm formation, and there is no leaching of the active ingredient which is seen, and there is no loss of activity over time, which is seen in case of the other available catheters. So plus there are other parameters wherein we have listed on. I will share this entire comparison chart with you all so that you can have a closer look at it and we can discuss it more. In spite of it being antimicrobial, it is an affordable catheter. The currently available infection preventing catheters which are there in the market, they are very expensive. They are not meant for a common man's use. So here is where in fact SilvoGuard comes into picture with the big bang, because it's quite affordable. It's an economical catheter, even though it is having such a fantastic technology. So overall, if we say, if we talk about the performance parameters, if other packaging parameters, if we see, SilvoGuard definitely is the catheter of choice for catheterizing a patient. Now, this was about the product. I will just take you very briefly through the team so that, because I started the presentation with this only, that, you all are a part of the innovation journey. So here in We Innovate Biosolutions, we are very conscious about the entire ecosystem, the entire team that we work with. We want to work with everybody hand in hand, and there is no hierarchy that we follow here. You are free to pick up your phones and call up anybody for any kind of doubts or any kind of queries. So just to give a sense of the team that has built this company has been built by 3 founder members: myself, Dr. Milind, who is the CEO and the founder of the company, and Dr. Prasad Bhagat, who is the CTO and the co-founder of the company. So we three are like graduate friends, but we are blessed to have some very good advisors on our board. So the entire process of innovating this catheter and coming up with this technology was supported by some eminent doctors in the field. We have Dr. Sanjay Kulkarni, who is like a world-renowned specialist in urology sector. So he is in fact supported us a lot and given us ideas of how to improve the catheter even physically, that I discussed with you all sometimes back in my slides. And Dr. Pankaj Joshi, who keeps giving us ideas on and off about improvising the catheter. For our silver technology, we are having a very good advisor, Professor Satish Ogle. He's one of the top 2% scientists across the globe. So we are very pleased to have him as our advisor. He also keeps giving us advice on our technology. And of course, we have Mr. Sudhir Sethi, who is actually the founder and chairman of one of the top VCs in India. So the company was started in the year 2016 by 3 of us. And we started this company when we received a grant from the government of India. It's a very prestigious grant called as a Biotech Ignition Grant, BIRAC, that we received. So we incepted the company, and the year after we were focused and we started growing big. So it was in 2017 that we acquired several new funds and grants from the government of itself. And it was in the year 2018 that we conceptualized the entire idea of Nano AG site, which I will talk to you about in some time now. Moving with Nano AG site, we went ahead and we established the concept of SilvoGuard. Since the technology was there in our hand, we had a beautiful silver nanoparticle antimicrobial technology that we had, and we in fact patented this technology. And then we had to export this technology for its activity. So we thought of first touching on the world of hospital-acquired infections, and that's how we conceptualized the entire brand of SilvoGuard. We received the patent from for our silver nanoparticle technology in the year 2020, and simultaneously we were working on the SilvoGuard catheters, and we received the manufacturing and the marketing license from the apex bodies in India. So this was about the company. Now about silver, like, why did we work on silver? Yeah, what was the need to work on a molecule like silver? So before I go there, let me just give you a sense of the need for developing an antimicrobial solution. So I'm sure everybody has lived this pandemic. Means I will use the word lucky, although we are unlucky, but we are lucky in a way to actually witness a pandemic in our lifetime. Not everybody gets a chance of this, and hope nobody gets a chance of such a chance. But nonetheless, we have witnessed what a simple bacteria or a simple virus can cause. So, as per statistics, the multi-drug resistant bacteria which are there, they are supposed to take more lives than any other diseases worldwide by 2050. So that's the number of that's the threat that we have of AMR. The matter of the fact is that every time a person gets admitted to a hospital, there are 10% chances that he may receive a hospital acquired infection. And we already know the kind of financial burden that this HAI or this hospital acquired infection causes on the patients as well as on the hospital. And when we use antibiotics to treat these infections, they are not only expensive, but they're also coming with some serious side effects. The silent pandemic of AMR is what Dr. Millen calls it as. So there is a need for a novel technology. Like, if you understand that, just excuse me for a minute. Yeah, so if you give it a thought that it almost takes 20 years for the development of a new antibiotic, and it takes loads of money to make this antibiotic, to come up with a new antibiotic. These superbugs or these bacteria, they take couple of generations to overcome these antibiotics. They immediately get these genes from the gene pool around them, and they develop resistance around these antibiotics in just a matter of few generations. So this is the difference in the time lag between developing a new antibiotic and a superbug getting resistance towards it. So that means there is a need for developing a new antibiotic or rather a new antimicrobial agent. So in fact, if you see that these currently used antibiotics which are there in the market, so these are all organic molecules. So these organic molecules have been in the market for the past 30, 40 years, or let's say 50 odd years. And today the bacteria have gained resistance to all these organic molecules. On the other hand, there are certain inorganic molecules which have been there around us since the time the earth was born. But still, the bacteria have not got resistance over these inorganic molecules. That's where we get a hint as to we need to find out a new kind of antimicrobial solution. And that's where comes in the picture the inorganic molecule I'm talking about is silver. So everybody knows about silver, that silver is an inorganic molecule, it's a metal, and everybody has had their first spoon of water from a chandi ka chammach with the help of their grandmom's hand, their mother's hand, right? So there was a reason behind it, that silver is known for its antimicrobial activity since our sages days, So silver has been known for its beautiful activity. It is since 69 AD, and now even today, the world is exploring silver for its antimicrobial activity. So here is where we took the clue of silver, and we thought that this is a powerful antimicrobial molecule which has to be explored for its activity and has to be given the justification to be used in different products. So we Innovate Biosolutions came up with the idea of nano AG-side. I will explain you nano AG-side. Nano means the nanoparticle form or the nano form. AG in scientific term means silver, and side means killing. CID, side stands for killing. So nano AG side means nothing but a nano form of silver which has excellent killing ability. The nano side or the silver nanoparticle that we innovate biosolutions has made has a very good activity, because it's going to be a sustained and a slow release of silver ions, which will give a consistent antimicrobial activity in the product where it is used. Then it doesn't have toxicity associated with it. Why? Because the size of the silver nanoparticle has been reduced to such a level that it sits in the perfect range where it gives a very good antibacterial activity but no toxicity. It is a very affordable silver. Silver doesn't mean it's going to be expensive, because the way in which we are producing the silver, the way in which we are manufacturing the silver, that is in such a way that it is only silver and water, and hence the cost of this silver nanoparticle is very, very less. Right now I will say that it is the most affordable silver nanoparticles in India, rather across the globe. We have tested the stability of this silver nanoparticles for a very long time, and up to 3 years of stability data we have, it still remains in a perfectly colloidal phase. And it is highly efficient. Moment I say efficient, we have tested these silver nanoparticles against bacteria, against multi-drug resistant bacteria, against viruses, against one of the toughest viruses which is to be killed, like the murine noroviruses. It is the toughest viral cell to kill. We have also tested it against the SARS-CoV-2, and we have got excellent activity of these silver nanoparticles against all these microorganisms, including fungi. So silver has been there since ages. Silver nanoparticle is not a new science, but why was it not explored in the world before we innovated? There were some clear problems associated when you talk about the silver nanoparticles at a commercial scale. If you talk about a laboratory scale, anybody can make silver nanoparticles. But we are talking about producing silver nanoparticles in a commercial scale. So there are 4 major problems which happens. One is you are not able to scale beyond a few ml, yeah, max up to a liter. So it is very difficult to make silver nanoparticles more than a liter. Even if you are able to make them, it is difficult to maintain them in the colloidal state that it is supposed to be. Even if you're able to do that, it's not going to be an affordable science, and the end product which you will make, the silver nanoparticles that you will get, will not be meterized, which will be actually, sorry, I got, yeah, it won't be in a matrice, which will be actually used in any kind of other material. So here is where we know solutions innovated and created a silver nanoparticle solution, which was actually scalable. So today we are able to make around 300 liters of silver nanoparticles every day, and these silver nanoparticles are having a minimum 3 years of perfect colloidal stability. They are one of the most affordable silver nanoparticles available across the globe, and these silver nanoparticles are present in water. So you can use them anywhere. You can use them on fabrics, on ceramics, on wood. You can use them in different polymers like latex, like silicon. So the versatility of these silver nanoparticles is widespread, and hence the doors open up for any kind of applications that you want to work with. Now, these silver nanoparticles scientifically have been characterized very thoroughly for its activity and efficiency. So you see over here, the graph, it indicates the spectra of the silver nanoparticles, which is giving a perfect bell-shaped curve. This is how ideally a good silver nanoparticle graph should look like, and nano AG-site gives you that perfect 400 nanometer bell-shaped graph. Then when you see the shape of these silver nanoparticles in a TM, you can see a nice, good spherical shape of the silver nanoparticles. So these are the attributes for any nanoparticles to be good. They have to be in the correct size range, and they have to be in the correct spectra. So nano AG side falls into the right bracket of spectra and size. We have not only the SilvoGuard catheter, that is the product which is made using nanoagicide, but we have also tested the nanoagicide itself for its bacteria killing activity. Now, how does silver actually, like yesterday I was talking to one person from Nepal itself, and I was discussing as to how silver actually acts on bacteria and kills them. So I will take a minute over here to explain. that this is actually how a silver nanoparticle looks like. This is the zoomed version of silver nanoparticle. So moment the silver nanoparticle comes in contact with any kind of an organic molecule, like here in case you see the moisture, the H2O2, it releases silver ions. Now it is these silver ions which actually kills the bacteria. This silver ions which you see over here, they will go and bind to the ribosomes, which will make the bacteria, which will kill the bacteria by not allowing it to metabolize the proteins. It will go and bind to the DNA, wherein the DNA replication will be inhibited, and hence the bacteria cannot multiply, and they will ultimately die. So this is the way the silver ions will work on a metabolic level. But silver ions actually works at a physical level also. Silver ions actually hit the bacteria like a bullet. So when they do that, they puncture holes inside they puncture holes on the bacteria, wherein the bacteria oozes out all its cellular material, shrinks and dies. So silver ion works at both the levels, physical levels also, like a bullet, killing the bacteria, as well as at a chemical or at the metabolic level also, by binding to key metabolic ingredients and not allowing the bacteria to metabolize and thereby causing its death. So this is a very beautiful picture that will explain, how silver is in real time killing the bacteria. So look at this third photo, like the first row, photograph number 3. You see some rectangular shapes, some brick-like shape, but they're all having smooth surface. This is nothing but E. coli at around 650 nanometer zoom. So these are all E. coli cells. So this is a control E. coli cell. If you see, the cell is having a very nice smooth surface, all the cells that you see over here. If you see exactly the picture at the bottom of this photo, you will see the same rectangular cells, but they're having very rough surface. They're having very hazy surface. This is because it is now treated with silver nanoparticles. So this is how we can say that silver is killing a bacterial cell and causing its death. We have tested this silver against a range of bacteria, gram-negative bacteria, gram-positive bacteria, multi-drug resistant bacteria, and we have seen that it is able to kill all kinds of bacteria that we have tested. And when I say we have tested, it is a third-party laboratory test which has been conducted on silver nanoparticles. Now, these silver nanoparticles are absolutely stable. As I told you, they are non-toxic. Like for the silver nanoparticles to create toxicity inside a human's body, it has to be more than 3 grams per kg of the body weight. Now we are talking about silver ions which are coming up from the SilvoGuard catheters. So there is no way it is going to have any kind of toxic effect on the person in which the catheter is being used. It is highly efficient. It is having a dual mode of action, that is which I just explained, and it is very easily compoundable. Like you can compound it to a fabric. You can, with the nanoegicide. In fact, today we have made antimicrobial fabrics, we have made antimicrobial mobile covers, we have made antimicrobial hand sanitizers. We have done a lot using this nanoegicide because it's easily compoundable in different matrices, and lastly but not the least, it is affordable. These silver nanoparticles also have been tested by international guidelines for their toxicity and irritation, and it passes all the all the tests, and it is absolutely safe to be used. So with this detailed presentation, I will thank you all for the patient listening. And now we can take questions, and we can make this interaction more